Next up, our second speaker is Prof. Hasford. Prof. Hasford is an Associate Professor of Medical Physics in University of Ghana. He's the Director of the Radiological Medical Science Research Institute of Ghana, Atomic Energy Commission. He's the Vice President for Federation of African Medical Physics Organization. He's a member of the Executive Committee of International Organization of Medical Physicists. He's a project scientific consultant for the IAEA, and he supervised several students and contributed to many book chapters. Prof. Hasford, we welcome you and we thank you for your time.
Thank you. All right. Good afternoon, everyone. So I'm going to speak on the challenges and then the way forward for nuclear medicine in Africa. So let's see. Okay. So my talk will highlight on Africa and what we know about Africa, cancers in low and middle income countries, non-communicable diseases, and then zoom in on the challenges facing nuclear medicine and then the way forward. So Africa undoubtedly is the most diverse continent in the world. Second most populous after Asia. Has about 54 countries. And so when you're dealing with Africa and its challenges, it's a bit complex. The continent has over 3,000 different ethnic groups, so you can imagine the situation. And then over 2,000 languages, different languages that are spoken in Africa. And you could imagine sometimes when you're traveling in Africa from one country to another, you'd have to move from Africa to Europe or move from Africa to Asia before you come back. And so the challenges in Africa is quite enormous, and it translates into nuclear medicine as well. So here on your right, you'd see a map showing income levels as categorized by the World Bank. And you could see where Africa is. These are the areas where you have the most number of low and middle income countries, where you have most of the people being poor. And so this is seen in our nuclear medicine services. So cancers in low and middle income countries, focusing more on Africa. Studies show us that the number of cancers or incident cancers in low and middle income countries contributes to about 60% of the overall total numbers of incidences and out of these numbers, between 70 and 80% will result in mortalities. And so a study was done 2018 where WHO looked at the prevalence of cancer against other diseases. And interestingly enough, if you put HIV, AIDS, malaria, tuberculosis all together, it still doesn't match up to what cancers are doing. So, out of every 10 non-communicable diseases, deaths that occur in the world, 7 or 70% is as a result of non-communicable diseases. And high on this end are cardiovascular diseases, cancers, and then respiratory diseases. Fortunately, nuclear medicine is a technique that is able to help us to diagnose and to treat these three most common diseases. So if you take overall number of non-communicable diseases that occur in the world, cancers are contributing to about 9.3 million annually. What is the status of nuclear medicine in Africa? So on this map that you see the distribution of nuclear medicine facilities in low and middle income countries. And this data is from the IAEA Nuclear Medicine database. And it shows, you could see the way the distribution is scattered in Africa. So out of the 54 countries that I made mention of, you have 30 having nuclear medicine facilities in Africa. And out of these 30, 16 would have just a single or a basic nuclear medicine facility. And the distribution is highly ununiform in the sense that you see in my presentation that if you take 4 countries in the Northern Africa and then add it to South Africa, where we are currently, it's about 80% and more of the total nuclear medicine facilities in the whole of Africa. So generally, if you take nuclear medicine procedures, spec procedures, you would have most of these facilities, nuclear medicine facilities, having access to technetium generators for scanning. However, if you move into iodine-131, lutetium, and the rest, then it becomes a challenge for most of the African countries. So the challenges in the entire region has been categorized into 5 main infrastructural problems or challenges: human resource, accessibility, technical and operational challenges, and then legislation and recognition. So infrastructural challenges. If you are very conservative and you would just say that, okay, let's go by the barest minimum, maybe a minimum of 1 million population per SPECT machine, then you could project that Africa needs about 1,400 SPECT machines. However, currently, there are just about 300 SPECT machines in Africa. And this shows in the shortfall that the region has. So this is translating into 0.2 SPECT scanners per million inhabitants within the region. And 85% of these SPECT machines are in South Africa and then the 4 Northern African countries, which are upper middle income countries. You talk of Egypt, you talk of Morocco, Algeria, and then Tunisia. Then if you talk about SPECT machines, so SPECT machines are available in only 6 countries in Africa, estimating to 63 in total. That's about 5% of the 1,400 minimum PET machines that are supposed to be in place. Now, cyclotron and radiopharmaceuticals. So we would have just about 5 or 6 countries in Africa with cyclotron. The other countries would purchase radiopharmaceuticals from countries like South Africa and then from Europe. And so currently, most of the countries, even in North Africa, would buy their radiopharmaceuticals from Europe. And some countries, because of challenges with clearance of radiopharmaceuticals from the airline agencies and all of that, and so it becomes even a problem for some countries in Africa to even purchase from South Africa. And so we would see that there is an infrequent and inconsistent supply of radiopharmaceuticals within the region. Currently, it's only South Africa that produces and then also cells, radiopharmaceuticals within the region. And if you talk about expensive and then specialized radiopharmaceuticals, they are mostly available in the northern part of Africa as well as the southern part. What about nuclear medicine therapy facilities? Currently, we have just about 20 countries practicing nuclear medicine therapies. And out of those, only 60% of the countries have facilities for inpatient treatment. And then the rest are solely outpatient. So most of the facilities here are concentrated in South Africa as well as the northern part of Africa. And if you are talking about lutetium, yttrium, iodine therapies, then it still comes back to the same issue. South Africa, Egypt, Morocco, and then Algeria. Let's look at human resources within the region. So as at 2022, estimates is that there are about 480 nuclear medicine physicians within the region, about 450 medical physicists who offer service to nuclear medicine facilities, and then 450 technologists in nuclear medicine. So, 85% of the total number of nuclear medicine physicians are working in these 5 countries that I made mention of. And if you think of a country that has 54 countries and only 5 are featuring prominently, then you ask yourself what the rest are doing and the sort of challenges that this pose to the region. So 6 countries provide specialized training for nuclear medicine technologists, and here we talk about Egypt, we talk about Algeria, Morocco, South Africa, Tunisia, and then Sudan. Now, if you talk about nurses who offer support for inpatient nuclear medicine physicians, currently there is no training program well established for such people. And so I think last year or so, Algeria made an effort to try and start this. I don't know whether there are other countries that have also initiated this kind of training. Then, of course, brain drain is an issue. So, the experience I've had within the region, a number of the countries would send trainees, train them, they come back. Within the next year or 2, you realize they are off. They find themselves in Europe, America, Canada, and the rest of the countries. And so we keep going around in circles. And this is a really big problem for the region. There's poor remuneration and conditions of service for hired personnel in a number of the African countries. In fact, most of the African countries. There are lack of job posts, inadequate education and training programs, and then lack of harmonized or standardized training syllabus. However, if you talk about medical physics through the International Atomic Energy Agency and the Regional Federation Organization, FAMPO, a syllabus was developed which tends to harmonize the training within the region. And I know that after this was done, a number of the other professionals have also initiated steps to get the training harmonized across the region. Then, of course, the training programs lack the inputs of advanced technologies like the artificial intelligence and the others that are coming up lately. And I think this is one of the things that we should factor in our training. I'm a medical physicist, so I'll be a bit biased towards medical physics, so I'm highlighting on medical physics. So this survey was done in 2020, and out of the survey, it came up that there are about 1,040 medical physicists in in a continent of 1.3 billion, 1.4. And 30% of these are female. So when we assessed the legislative recognition for medical physicists within the region, it was realized that only 6 countries has legislative recognition in the sense that their health systems recognize medical physics professions. And so one of the things that the Federation of African Medical Physics Organization embarked on is to now register medical physicists within the region as a form of more or less like a certification, not certification specifically, but to register and have a database of all medical physicists within the region. And so this activity has started. Now, the map you see here shows the education and training sites within the African region. So the blue spots are for the clinical training sites, red spots are for the academic. So overall, about 10 countries has academic training sites, but then just about 7 or so has clinical training sites. So out of this study, it was realized that the number of diagnostic radiology and nuclear medicine clinically qualified medical physicists is largely inadequate by a factor of about 20 across the region. So this tells you about the gap that needs to be filled. What are the technical and operational challenges? Frequent breakdown of installed equipment, largely due to poor maintenance as well as unstable power supply in a number of the countries. Poor service contracts or after-sale agreements, high equipment downtimes. Sometimes equipment can be down for 6 months up to a year, still not fixed. Absence of equipment service hubs within the region, and so you'd have to wait for the engineers to be sent from Europe or from elsewhere to come and service equipment. I know some countries do have. Lack of skilled on-site engineers to handle these sophisticated nuclear medicine equipment, absence of audit, quality assurance programs. So the IAEA has this comprehensive audit called the Quantum Quality Assurance Audit for Nuclear Medicine. And as I speak now, it's only 6 sites, nuclear medicine sites in Africa that has been able to go through this quantum. Absence of regional clinical imaging guidelines. So you have almost all centers using their own guidelines. Absence of regional and local or national diagnostic reference levels. Then internet connectivity, which is hindering or telemedicine networks. So accessibility challenges. So about 52% of the African countries do not have access to nuclear medicine, and this tells you about the access to nuclear medicine services. And this translates into about 60% of cancer patients in the low and middle income countries lacking access to nuclear medicine as well as radiotherapy services. And then for some of the countries that have these equipments installed, utilization is also another issue because some would receive, let's say, 1 batch of technetium in the whole of the month, or sometimes even in 2 months. After use, the equipment is down, is not working. So utilization is very low in the region. Legislation and recognition challenges. So the International Basic Safety Standards, the BSS, clearly specifies the role that medical physicists are supposed to play in nuclear medicine and radiotherapy and diagnostic radiology. But then, within the region, it is not being implemented fully. And a typical example is where you have medical physicist services in nuclear medicine and diagnostic radiology not being made mandatory in a number of the African countries. And so you would have centers practice nuclear medicine and diagnostic radiology with no recourse to any medical physics whatsoever. So what is the way forward for Africa? What do we envisage to see in the future? So we need to have commitment. And if I say commitment, I mean commitment, not just word of mouth, from governments and leadership. And this goes to say that there is a need for more or adequate funding for nuclear medicine services, long-term infrastructure and workforce planning, more expansion projects in nuclear medicine across the region, strengthening of education and training and research programs within the region, and then strengthening national legislation provisions for nuclear medicine, as well as integrating and working closely with the World Health Organization. I must say that, in several African countries, I think what the health ministries understand is when World Health Organization speaks. I think most countries don't understand when IAEA speaks, especially if it comes to health systems. And so if there's a closer collaboration with World Health Organization to champion the promotion of nuclear medicine services, it could go a long way. Strengthening nuclear medicine professional bodies nationally and then regionally, and then also relevant global professional networks, which is very important. Then, of course, we need to deliberate on national efforts to recognize the professionals in medical physics. So, in nuclear medicine, so medical physics as a test case is not recognized in several African countries, and so countries within or governments or Ministry of Health within the various African countries would have to make a conscious effort to recognize these professionals. And then also develop national projects that takes into account education and training, equipment, supply of radiopharmaceuticals and expertise. Then seek the support of International Atomic Energy Agency, especially in areas of training and then technical support where such countries lack the capacity to do so. And then, of course, partnering with IAEA and private sector, public-private partnerships, very important to help develop the nuclear medicine field. And then also participating in coordinated research projects, which brings together scientists to collaborate on areas of common interest and of importance. So I'll conclude here that these major obstacles is accounting for the reason why about more than 60% of cancer patients in Africa are not having access to nuclear medicine. And this, I believe, it is unacceptable to all of us. And so all of us, leadership, stakeholders, development partners, would have to team up for us to be able to develop the field. I would want to thank you and all the organizers for the opportunity to be here and to speak on this forum. Thank you.